Hi there. Welcome to the April meeting of Women of Wedgwood. We are an intergenerational group of ladies committed to supporting the work being done at Wedgwood. Wedgwood Christian Services has been supporting children, adults, and families since 1960. We do that by supporting those who are struggling with behavioral, mental, and emotional challenges. Now, April is Autism Awareness and Acceptance Month. So today we're going to be talking to Dr. Candace Lake, Director of Wedgwood's Autism Center for Child Development. Now, before we get started, please take a moment, say hi in the comments. We'd love to hear from you. And if you have a question, type it into the comments. We'll be getting to those at the end of our conversation. Thanks for joining us. Welcome, Dr. Lake.
Thanks so much, Vivian. I'm happy to be here.
Good, good. Let's start talking about autism. We've all heard of autism. We know families who have been impacted by autism. What is it?
Good question. So autism is a complex neurodevelopmental disorder. It's characterized by deficits in social communication and interaction and with restricted and repetitive behavior. So generally you have symptoms in both of those two areas. So the social communication and interaction involves a bunch of different skills and behaviors. So eye contact is one of them, and that's one that people usually hear of. So they've heard of, somebody with autism doesn't make eye contact. Well, that's not exactly true. So autism is a really broad spectrum, and so you can have individuals who avoid eye contact. You can have some who make a lot of eye contact and to the point where it's kind of uncomfortable. They don't know to look away periodically during a conversation. Or you can have some where they make some eye contact when they're really motivated, but maybe they don't coordinate it with other forms of communication like their vocal speech or their gestures quite in the same way that somebody without autism does. Facial expressions can also be affected. So you may have a really flat affect, so somebody who doesn't make a lot of different varied facial expressions, or you could have really animated, exaggerated expressions. So it's one of those where it's not quite the same as everybody else that they're doing, where it's different. Gestures are part of that social communication and interaction as well. So you may have a total lack of gestures. You may have some that are just a little bit different or awkward, or you could have somebody who's really animated all the time. They're really a hand talker, and they're doing all of those things, and I did this, and we went over there, and it went like this, and where it's just more than you would typically see. And another big part of that is the back and forth of social interaction. So you can have somebody who does all of those other things fairly well, but conversations are pretty one-sided. So when that back and forth isn't there, that's also a sign of autism. And those are the individuals that are often diagnosed a bit later because they do pretty well. They don't stand out. They do fairly well until those social demands kind of outpace their capabilities, and so then they start to look like they're not fitting in quite right.
Got it.
And then we also see the restricted and repetitive behavior. So that could be in something physical like motor mannerisms, like some finger waving or some hand flapping, some bouncing, jumping, spinning. Sometimes we have some really active individuals. Or it could be in the types of interests that they have. So they might be really interested in, Lego Batman, but that's kind of it. Or what type of dog food your dog eats. Some kind of interest where it's an unusual interest for the person's age or abilities, or it's just so perseverative that it's really the only thing that they're interested in. They could use the same words in the same way. They could always say, "Oh, I like that. Oh, I like that," and it's kind of the same intonation and pattern a lot of the time. You can also get individuals who speak very formally. So you'll either have individuals who have very delayed language, and those are often are identified fairly early. If you have a 3-year-old who's not yet speaking, that's usually a cue to say, hey, we should maybe, get some assessments done. But you may have individuals who are very advanced verbally for their age as well. So we have kids that they're known as the little professor, at home, because they'll teach you all about the solar system, and they know way more about it than you would expect, a little 4-year-old to have. And those individuals that may also qualify as one of those symptoms in the categories as well.
Okay. So predominantly communication challenges. communication challenges impacting socialization.
Yep, absolutely, you've got it.
Okay.
That and then the restricted and repetitive behavior. When you put those two together, that's when we say an individual has autism.
Okay, all right. Now, how is a child diagnosed? How do we do that?
Excellent question. So there's no blood test or brain test right now for autism. We think down the road there will be, and science is getting there, which is really, really exciting. But right now it's diagnosed behaviorally. So you'll meet with a psychologist or a developmental pediatrician. Some social workers have the training, neuropsychologists, and they'll do a series of assessments. So one of those is where they'll set up social situations, and it's designed to see behavior that's relevant to the diagnosis, and they'll see how the individual reacts to certain situations, how they look to their parent or caregiver if they're a child, and how they interact and respond to the different situations that are presented, and that gives you really good evidence about, compared to others, their social communication, and you also have opportunity to see restricted and repetitive behavior. But that's not enough to make a diagnosis. So autism doesn't happen in a vacuum. It's not just in one setting. So we don't assess it just in one setting. Usually you'll want to talk to multiple informants. So you might have daycare teachers or school teachers, parents, of course, primary caregivers, and then the psychologist or the assessor as well is going to do some direct observation, but they're going to get information from other people and in other settings as well. They may want to see the individual interact with peers. So some individuals on the spectrum do really well with people who are a lot older or a lot younger than them, but not so much with same age peers. And so it's important to be able to see them interacting with them to know whether, their behavior really is atypical.
Interesting, interesting.
And they'll gather a lot of information about the early history. So parents are a huge source of information for that. So I would say if you have a concern about your child's development, talk to your pediatrician, say, hey, I really want to look into this, and don't settle for a wait and see approach. As the parents, as the primary caregivers, you know your child, and sort of push for that.
Got it. Yeah. Is there now, Dr. Lake, a screening? What are Michigan's regulations in terms of well visits and autism screening?
There are. So children should be getting screened at many of their well child visits. And there's specific autism screenings both at 9 and 18 months.
Wow. So early. Amazing. Yeah. Good. Okay. Now, according to the CDC, the prevalence of autism, I believe 20 years ago, 2000, was 1 in 150 American children, and the latest research tells us 1 in 54. Yeah. Why?
It's a big difference. That's a big question. It's something that a lot of researchers are working on to figure out, and we've come up with it's a combination of things. So far what we know is that there's a big piece that is awareness of autism. So even 20 years ago, you might label somebody as just quirky or eccentric if otherwise they were doing pretty well. So you might have somebody who's really great in school and academically they're fine, but they have trouble keeping friends. And that individual, they may not have done much about it. They may have put them in like a lunch bunch at school or something, and that may have been it. So if they weren't more severely impacted, they may not have been identified. And then you have the other end too, where they used to just say, oh, there's special needs. And they might put them all in the same room with individuals with other, healthcare needs or impairments, and so they didn't try to figure out too closely whether it was autism. And our picture of autism has changed too. 20 years ago, people would say, oh, like Rain Man, if you talked about autism, right? And that's one stereotype and that's one picture of autism, but the real picture of autism is very broad and very different. So individuals can be very, very different presenting and both qualify for a diagnosis of autism. Right. So there's a lot better awareness now, and particularly in girls. So it turns out that autism looks different in girls than in boys. And so there are a lot more boys diagnosed with autism. It's about 4 to 1 with girls, but we're starting to identify it in girls more frequently and earlier because we're realizing that they mask symptoms differently. Sure. Yeah, so a lot of it is awareness and then better assessment tools as well. Lots of community awareness. And then the other part, we don't know yet. So we think that there's a lot of environmental factors, but it's really hard to test for those. So you can't go and take away like pollution and things like that in a certain environment, or maybe something happened during pregnancy, but it's an interaction of factors. So we know that there's a heavy genetic component to autism, and then there's an environmental component as well. But it's not as simple as if you have this, genetic thing, and you're in this certain environment, like with pollution, then your kid is going to have autism. It doesn't work like that. It's really an interaction of factors, and it's a lot more nuanced. It's also not just like one autism gene. There's a bunch of them that have been identified that are more associated with autism, but there's no perfect correlation. So there can be chromosomal deletions and translocations that can contribute, where a lot of the individuals with that certain, difference in their chromosomes are also diagnosed with autism, but none of them are perfect, and not everybody with it usually has autism, or not all autism has the same kind of chromosomal deletion or any chromosomal deletion. So some of it doesn't have that associated with it.
So no clear answer yet.
Right.
Lots more research to do. Okay. Yeah. Okay. So then that brings us to the next question. What are the recommended treatments, and is that even the right word?
Yeah, there's lots of interventions. Treatment, I think, is a fine word, intervention, but I think it's important that we don't say that there's something wrong with individuals with autism. I think that God doesn't make mistakes, and we're all the way we are for a reason. But that doesn't mean we can't improve lives. So there are interventions we can do that are really impactful and really beneficial for individuals with autism and their families, and can change their lives and their whole trajectory. And all of the ones that have been well established in the scientific literature are based on applied behavior analysis, or ABA. So they have this foundation on this science, which is a science that tries to make meaningful changes in the lives of individuals.
Okay, wonderful. So let's now talk a little bit more about ACCD, the Autism Center for Child Development here at Wedgwood, that you lead, that you launched in 2015.
Yes.
Is that right? 2015?
Yeah, that's right, yeah.
Congratulations.
Thank
coming
you.
up on 6 years,
yes.
right?
Yeah, we just celebrated 6 years, yeah.
Fantastic.
Yeah.
Great. Now, there are many options for families with young children. Talk to us about ACCD and your philosophy of what makes it different and special.
Great. So we see individuals with autism, young children, and we treat all of the areas that are affected by their autism spectrum disorder. So we do comprehensive early intervention in a fun, engaging environment. So we have classroom-like settings. So they have individual work areas where you can really focus and you can really teach toward the individual's strengths. And we also have in each room some group play spaces, so the kids can interact together, because that social interaction is half of the diagnosis. So that's critically important. We set up learning groups and circle times, and it's really fun and never boring at work. And the philosophy that guides us, there are a few principles. So we strive, for Wedgwood's values, and then additionally excellence. So we want to provide the highest quality services. So ABA is individualized, so we don't do cookie cutter treatment. We're going to do a long assessment process. We're really going to get to know the child and know what their needs are and where to go next for their skills. And we're going to work with the family to figure out what their priorities are as well, and work on those things. So we don't just dictate the treatment. We work with them. What's important to you? If it's sleep, that is a big deal, because if the child isn't sleeping, the family's not sleeping, and it affects your entire life if people aren't sleeping. And so we may try to focus on that first. That may be a priority, because once you fix that, a lot of things get easier, when people are less stressed and they're sleeping better. And we do those collaboratively with families. So we want to provide the highest quality treatment and really care for the individuals that we have. And we develop very strong relationships with our clients and families. And when they graduate, we're so proud of them, but it's also bittersweet because they're leaving our nest, But that's what we've always wanted to do. We try to work ourselves out of a job, but it is hard when they leave, because, we adore them and we've worked so hard together on all of their goals. So excellence is one of them. And then we do it while adhering to the highest ethical standards. So ethics is another one. Yes, we see, right now we're seeing that early intervention for ages right from diagnosis, so around age 2 is usually as early as it's diagnosed currently, up through age 6, and generally when they go to school. We've also just started some social skills programs, so for older individuals that are in elementary school, and we're starting a summer camp program as well just this summer. So that's going to be a 5-week session, and that's going to be for ages 8 through 12. So that's really exciting. So we're broadening our age scope as well. So again, the excellence, the ethical standards, and then the last thing is the environment. So it's really important to me that the therapists that work with the children like coming to work, and that they work in a place where they feel supported, they feel like they have the right training, they know what they're supposed to be doing, and they're confident, and they're supported. So if there's a problem, they can say staff, and people will come running. Their supervisors are there. The BCBA offices are right in the same area as the classrooms and where the clients are. So somebody is always watching and supervising to make sure that treatment is being provided well and therapists feel supported. And so having a place where we want to come to work is really beneficial, because then we get people staying longer, and that consistency is so important for individuals with autism. So when you have less turnover of staff, you build those relationships that we have, and that's really key. We have people who have been invited to children's kindergarten graduations and these awards in the community because of the relationships that they've been able to build. So those are things that are really important to us.
Fantastic. So 2 to 6 years old for the early intervention.
Right.
The social skills group, after schools, elementary school.
Yep.
And then tweens and early teens at summer camp.
Yep, that's
Fantastic.
right. That's right. And we'll be adding more ages for the social skills and the summer camp as well. But we're going to start off with just one group and one certain age, because, like I said, we want to do it well.
Yes.
We want to make sure that we're providing high quality therapy, and that you're getting the bang for your buck. If you're going to spend your time in therapy, we want you to actually be benefiting from it. So once we get that where we know we're doing it well, we're going to expand the ages.
Oh, that's great. That's great. Let's talk a little bit about transformations. We at Wedgwood talk about lives transformed, transforming lives. How do you see, through all this therapy that we've talked about, give us an example, if you will, of a life that was transformed, or family.
Certainly. We hear a lot of first words in the program, and that is something that I will never get sick of. I will never have enough of that. We heard a 5-year-old say mama to his mom for the first time once, and there was not a dry eye in the place, let me tell you, and I still talk about it. We see a lot of firsts. We see kids toilet training. We do a lot of toilet training, and so not using diapers anymore, and then that means a lot of freedom. We had an individual just for spring break. They were able to travel with their family on a family vacation, and they had never been able to go before. They had never been able to take this child because of their behavior in public, and they got to go. And so the child came back, and they're talking about the beach and the sand and the water and all of the fun they had with their family, and that's such a huge deal for them. So those are some, and then we also have some individuals who are really severely impacted by autism, and who have a lot of aggression or self-injurious behavior. And we had one individual who was 3 and had been kicked out of 3 daycares and had been put on wait lists, everywhere else, and came to us. We had the first day, we're talking to the family afterwards, saying, okay, she had a great day and we'll see you tomorrow. And they said, she can come back? And my heart just broke a little bit, because I realized that this young lady had never been able to go back for a second day anywhere that she had been, because of her behavior. It was so severe because of the aggression, and the danger to the others. And we're fortunate enough to be able to set it up. We cleared out the whole classroom, so she had a whole classroom to herself, for the first couple of months while we were treating that aggressive behavior. And then as that reduced, we were able to slowly introduce other children back into the classroom. And by the end, she had friends, and that was a huge deal, because the parents were able to get jobs. They had never had anybody who would watch their child before for them, so they never got a break, because this is a child who needed constant supervision for safety. And so now all of a sudden, they were able to get days worth of, they had time where they could have jobs, and they could rebuild relationships with family and stuff. And that was really, really a blessing to be a part of that.
That's amazing. That is amazing. Congratulations. I love how you are customizing the approach to the unique
Mhm.
child.
Mm-hmm.
That is beautiful. That's honoring who they are.
Absolutely.
That is amazing. Now, let's talk about, you mentioned families. What do
Mhm.
you hear most from parents when they continue to work with you and they see those transformations? What do they say to you?
Some of the most meaningful ones I've heard, you gave me my child back, and that's a huge one. Or they say, I know them better now, they can tell me what they want. And they weren't able to do that before. We just had to guess.
Right.
They're so much happier. They're not a little ball of rage anymore. Because sometimes, that can be the case, which if you think about it, if you needed things and wanted things and you didn't have a way to get those, you'd be pretty frustrated too. So now they can say, oh, they wanted Cheetos. Oh, okay, I can get you the Cheetos, Or they're cold. What if you're cold all the time and you couldn't, ask for a blanket or something like that? So communication is a huge thing that we work on as well, teaching the individual a way to get what they want. And we also try to increase their independence in lots of things. So, you may have 5-year-olds who aren't dressing themselves or brushing their teeth. We work on all of that stuff. And families, it's just a relief for them, so the kids are able to do things that their siblings can do and their friends can do. And that's really exciting for them and really meaningful.
That's incredible. What would you say, Dr. Lake, to a family who's just received an autism diagnosis? It's life-changing. What would you say to that family?
It is life-changing. So one of the things that I say first is there's hope. We know what to do now. It's hard to get a diagnosis of autism, but it's still the same kid you know and love. There isn't anything that you did that, made your child have autism, and we know what to do now. We know what the effective treatments are, and we can make a plan together to move forward and to improve things. We want your child to have as independent of a life as possible, and a life that's filled with joy and things that they enjoy and like. We call it reinforcement in behavior analysis. So we want them to have access to reinforcement and leisure and all the opportunities that parents want for their children too, and that's what we'll work for. So things can get better, but we're not going to fundamentally change them. We don't want to make them not the same person they are, and that's not what therapy is about. It's really about increasing independence and access to stuff that they enjoy.
Great. What are 3 things that you would say to friends and extended family of those dealing with autism? What are 3 things those folks could do to support the family impacted?
That's a really inspired question, Vivian. I like it a lot, and I had to give it a lot of thought. So first, I would like to say that every family is different, and every individual with autism is different. And so if you know your friends and family members well, ask them. Ask them how they can help, and not just that. Well, if you ever need anything, shoot me an email or give me a call. That's not the real helpers. That's not what you do for people that you're close to. I mean, sit down and say, hey, this is probably a hard thing, and I really would like to support you. How could I do that best? And I do have a few ideas. So ABA therapy, or comprehensive intervention for young children with autism, is intensive. And so instead of, a half-hour appointment once a week, this is like 40 hours a week it can be. So 5 days a week, they're going every day for several hours. And transportation to that can be a barrier to treatment. Not everybody can do that if they have to get their other kids to school and childcare, or they have to go to work. So offering to transport the child to therapy. Those rides, that could be the difference between an individual getting as much therapy as is recommended for them versus not. So that is one thing that could be a big deal. And another one is respite. So a lot of times I talk to families and they say, no one will watch our kids. And so they never get a break, ever. Because obviously they love their kids and they know they need them to be with somebody they trust and that can keep them safe and protect them. And so if there were people in the family who would be willing to do that, that could be really helpful. But it's not always easy to do that because you may not know how to handle the individual with autism, especially if there's challenging behavior. And so you can offer to the family, I'd love to be able to do that. Can you teach me how? Or can I take just the child with autism or just the other children? And so then, they get alone time because the siblings, they need help and support too, because a lot of parents' energy does end up going to the individual with autism, and that's hard for siblings too, so they need special time too. But you could even offer to attend like a parent training session. We would love to do that with caregivers at our center. So we often do parent training sessions, and we're doing a lot via Zoom these days, and that's okay, and parents can do that, and then they can attend from wherever they are, which can be really helpful. And so if you wanted to offer to attend one of those so you know how to interact with the child, that would be something that would be really supportive, so the families could get a little break.
I love that.
Yeah, good questions.
I love that. So transportation, respite, and what was number 3?
Number 3
was asking.
is yes, asking, and then also listening to them.
Listening.
So a lot of times families will tell me that autism is really isolating because their friends and family don't really know what they're going through, and that the 24/7 care. We've had families who couldn't take a shower because it wasn't safe. Because one time they did, and then their 4-year-old with autism came in with a knife. There was bleeding. It turned out okay, but can you imagine not being able to take even 10 minutes for yourself because you're worried about your child? And then not only just that immediate worry, but for the future. You're thinking, what's going to happen when I'm gone, or what happens when they go to school, or when they're gone all day at therapy and they can't tell me what their day is like. How do I trust people? So there's a lot that goes on and that they're thinking about and worrying about and trying to plan for, and a lot of people don't relate to that, or they'll just say, oh yeah, parenting is hard, my kid too, blah blah blah. But it really is different, for individuals who are supporting a child with special needs, particularly autism. It can be very challenging. So listen to them. So you've got it rough. I want to hear what's your day like? What are you worried about? And just listening sometimes can be really cathartic for the person telling you the story, and you don't have to solve their problems. They just need the friend and the support. So that's another thing that I hear a lot from families.
So be an ear. Be an ear.
Absolutely.
Good. Okay. So final question before we go to some viewer questions is, what can we do as a community to support legislation? Is there anything, do we have any power? What can we do?
We do, and I've been learning about that a lot in the past couple of years. So talk to your legislators, your representative and your senators. They want to hear from their constituents. So you can call them, you can email them, you can write a letter and ask them to support the autism benefit. Continued funding for the autism benefit is really changing lives in Michigan.
That's fantastic. Good. Well, we will share all of those tips with you. We will put that all together for folks. Let's look at some questions. We've got some questions here from viewers. So here is here's a question from here in Grand Rapids. Is autism something that can be cured or recovered from?
That's a good question, and kind of controversial. So there are people who have different feelings about this. So autism is a complex neurodevelopmental disorder, and it's generally something that you anticipate affecting the individual for their lifetime. However, like I said earlier, there's not a blood test for autism currently. It's diagnosed behaviorally. So, you observe different behaviors, and you take the caregiver report and the teacher report, and you determine, whether these symptoms are present. And if enough of them in the different areas are present, you say, this person meets criteria for a diagnosis of autism spectrum disorder. So through therapy and treatment, some of those symptoms will alleviate, and then they may no longer pass the threshold for a diagnosis of autism. And so then you don't say this individual has autism anymore. So autism is a broad spectrum, and individuals can move off that spectrum, and they do. And that's really part of the goal of therapy, to get them functioning well enough and independently enough that they're not severely affected by their neurodevelopmental disorder. Now, do things in the brain change with behavioral therapy? Yes. Things in the brain actually change with behavioral therapy. Do chromosomes change? No. So if that's part of, the individual's, the reason that they have autism, that's not going to change. But they may improve to a degree that they're not identifiable as somebody with autism. So I don't like talking about a cure. It can be really controversial because autism can be really a big identity for some people. And and they may think that, hey, you're trying to get rid of people with autism, and that's certainly not the case at all. We don't try to get rid of, STEM behaviors or anything like that if they're not interfering with learning or interaction. You can absolutely do that. You can be quirky. That's the goal, We like people with personalities, and we certainly don't try to train that out of them or anything like that. We don't try to make kids all behave the same, and we don't just force compliance where you just have to listen to adults. That's not it at all. We certainly teach kids ways to say no. We had one young man who told us, "I'm just living my life." And that came from us, which we taught a little bit by accident. He liked to kind of control the way we were sitting. So if we had our legs crossed, he would say, "I don't want you to sit with your legs crossed." And so, or "I don't want you to hold your hands like that," or "I don't want you to wear that shirt." And so we would say to him, "I'm just living my life." And he picked that up, and he started saying that to his parents. Grandpa told him one day to turn off the TV, and he said, "Grandpa, I'm just living my life," which we thought was hilarious and heartwarming. And then we also thought, oops, maybe we'll have to teach him an appropriate way to say, "Can I have 5 more minutes, please?" or something like that. But we certainly allow them to have personalities, and we want that. So we don't try to cure it. It's not a disease that we want to get rid of, but we do want people to be able to function well in their environment. So instead of flopping to the ground and hitting his head on the floor, he said, "I'm just living my life." And to me, that is a huge win. That is great. That is a much better way to handle things, and totally acceptable, and also cute, because who can resist a 3-year-old who just says, "I'm just living my life"? I say, "Sure, you go ahead, you watch your show."
That's great. That's great. All right. Another question we have is, what progress has been made so far in autism research? Any one key point?
Yeah, that's a really good question as well. So tons of progress is being made all the time. Lots of research is going on. I can't think of one thing that's really like the biggest thing, but I do know that all of the studies that are happening now and continue to happen and have been for the past 40 years lead us to improve what we're doing. So they improve therapy to be more efficient and more acceptable to people. So we have kids who like coming to therapy. They run into the door. We had to turn a little guy away because he had a temperature the other day, and he cried, and he was so sad that he couldn't come to school and be with his friends because COVID policies. But he was better after that, and got to come back, and that's great, and that's what we want. So everything that we can do to improve therapy is great. So there is a lot of good research going on. And we're always trying to learn to do things better and more individualized for each individual. So it doesn't all look the same, and it certainly doesn't look like it did 20 years ago or even 10 years ago.
Amazing. Mm-hmm. Well, because you speak of this broad spectrum, you can have folks who are verbal and completely nonverbal, and so you couldn't do a cookie cutter approach, right?
No, definitely not. No, we have people who communicate in all different ways. We have vocals who use complete sentences and speak more eloquently than I do. We have some who don't speak at all and use communication devices or icons where they hand you a picture of, fruit snacks, and you're like, okay, you want fruit snacks. I know that's easy to understand. We have signers who use sign language, and all different kinds, and we like to be flexible and use their strengths.
Sure. Let me look at one last question here. Are people still questioning vaccines as an issue?
Oh, that's a good question.
Molly wants to know.
People do, yes, but is that warranted? No. So the science is really, really clear that vaccines do not cause autism. Just as many, autism is just as prevalent in individuals who are not vaccinated as those who are, and there's been lots and lots of research showing that vaccines don't cause autism. That doesn't mean that question has gone away. So there's a lot of people who don't really believe in the scientific community or don't have access to all of the research studies that I do. And if you are interested, I can give you a whole boatload if you'd like. And I do love to outreach with people and to talk about what I do. So feel free to contact me. But I am convinced by the body of research that autism is not in any way caused by vaccines.
Thank you. Mm-hmm. Thank you for that.
I do have one other thing to say about that as well.
Yes.
And that's that autism isn't the worst thing that can happen. So there are a lot of families who are offended by the thoughts of people saying, I'm not going to get a vaccine because what if my kid gets autism? They're like, what are you saying about my kid with autism? They're awesome. And, I would say that death from smallpox or something like that is a much worse fate than autism, certainly. Autism can be very challenging to deal with, but also these individuals are amazing and resilient. And most of their families wouldn't change, their core personalities. And I wouldn't either.
Oh, that is powerful. Thank you for that. Thank you so much, Dr. Lake. I want to take a minute and affirm you and recognize you for the work you do at the Autism Center every day. You have an incredible heart to go with your incredible mind. And the combination of the two is just unstoppable. And you are leading a wonderful team and changing lives. Every family that is impacted by your great work owes a debt. So I want to recognize you for that.
I have an incredible team. Really, really great crew of people who do good work every day, and they do it quietly. They don't do it for the praise. They do it because individuals get better and families, are relieved and live better lives. And we love that. I will teach another kid to talk. I will keep doing it day after day after day to hear that again.
That's fantastic. Well, thank you. It's a privilege to work alongside you here at Wedgwood, and thank you so much for your time, Dr. Lake.
Thank you. Appreciate your time.